Why is bone microarchitecture important for osteoporosis? Imagine your bones as a complex, tiny city built with countless structures working together to keep you upright and active. Now, think of bone microarchitecture as the blueprint of this city, showing how the buildings and roads are arranged at a microscopic level. This detailed structure includes the tiny, spongy parts inside bones called trabeculae and the outer layer known as cortical bone. While bone mineral density measures how much mineral is in your bones, it doesn't tell the whole story about how strong your bones really are. That's where microarchitecture comes in. It's a key piece of the puzzle because it directly affects how resistant your bones are to breaking. In osteoporosis, bones don't just lose mineral content, their internal structure also deteriorates. The tiny trabeculae become thinner, fewer, and less connected, and the outer cortical layer can develop more pores. This breakdown makes bones much more fragile, even if the overall mineral density isn't extremely low. So, a person might have a bone density reading that seems normal or only slightly reduced, but their bones could still be at high risk of breaking because the internal architecture is compromised. That's why understanding microarchitecture is so important for a complete picture of bone health. Bone strength depends on both how much bone you have and how well that bone is built. The arrangement and connectivity of the tiny trabeculae help bones resist forces like falls or bumps. When these structures weaken or become disconnected, bones lose their ability to withstand stress, leading to fractures. This is why two people with similar bone density levels might have different fracture risks, because their bone microarchitecture could be very different. Research shows that deterioration in microarchitecture is strongly linked to fracture risk. For example, if the trabeculae become thinner or less numerous, or if the outer cortical layer becomes more porous, bones become much more prone to breaking. Tools like the trabecular bone score and high-resolution imaging techniques can assess these microstructural features without surgery. These methods help identify people at risk even if their bone density looks okay, giving doctors a more complete understanding of fracture risk. Different bones and parts of the skeleton have unique microarchitectural patterns. For instance, the bones in your neck tend to stay denser and better connected than some of the lower spine bones. This explains why certain bones are more likely to fracture in osteoporosis. As we age or if osteoporosis progresses, the microarchitecture worsens. The cortical bone becomes thinner and more porous, and the trabeculae lose their connectivity. These changes weaken the overall structure, making fractures more likely. Incorporating microarchitecture assessment into osteoporosis diagnosis and screening provides a more accurate picture of fracture risk. While bone mineral density testing is useful, it doesn't tell the whole story. By looking at the internal structure, healthcare providers can better identify who is truly at risk and tailor treatments accordingly. This is especially important because some people with normal or borderline bone density still have fragile bones due to poor microarchitecture. In summary, bone microarchitecture is vital because it influences bone quality and strength beyond what bone mineral density can show. It helps explain why some bones break easily even when density seems adequate. Understanding and evaluating this microscopic structure improves diagnosis, risk prediction, and ultimately helps guide better treatment strategies for osteoporosis. If you're concerned about your bone health, always consult a healthcare professional who can provide personalized advice based on your unique situation.